So Trustee Taylor, unfortunately, I don't get a notification of like who accepts all of these, like the calendar invites when they come from WebEx. So I don't know if you wanted to get started. My feeling is this is our group today.
This isn't California. We don't have to wait 5 minutes.
No, we don't have to. Not if you don't want to.
This is Colorado. We step right in. It's 1 o'clock, and I'd like to call the meeting to order. Thank you, everyone, for joining. I'd like to introduce Aaron Bertoli and Jenna Metzinger. They're going to provide us with some good information about marijuana hospitality establishments from the Center for Public Health Practices here in Colorado. And before we begin, I thought it might be very helpful if we could each kind of provide Jenna and Aaron with some information about who we are so they know to whom they are speaking. And so I thought I might get that started by just going through the role here very quickly. We're not all here. So I wonder if Allison Bailey, perhaps you could give us let everyone know who you are and what you're doing on this meeting, on this committee.
Great, thank you. My name is Allison Bailey. I'm the program manager for the Community Substance Abuse Prevention Program with Boulder County Public Health. To work with community coalitions and community partners around how to reduce youth substance use in Boulder County, and really excited to be part of these conversations and grateful to have our experts here. Thank you.
Angelica.
Just interjecting, this is Stacy and I'm here. Thank you.
Hi, Stacy. Angelica, are you here?
Yes, can you hear me?
Just barely, Angelica. Is there a way you can turn up your mic? I'm not sure.
Is this better?
Oh, that is much better. Thank you.
Fantastic. Yes, I am with Agati and I am here for information gathering. I have read the presentation and so I'm looking forward to hearing this presentation. Thank you so much for the invitation.
Ben.
Got me moving my laptop. Hi, Ben. I staff a coalition.
So Ben, your volume is way down as well. I wonder if there's a way you could increase your volume. Doubly important because I'm hoping for questions here.
Is that any better? I don't know.
No, not really. A little bit. Well, Ben, I'll just ask you to speak up if you could.
Okay. I am
Oh, that's better.
Coalition in Netherlands, so it's just cruddy headphones. In Netherlands, I staff a coalition that works locally on youth prevention issues called Communities That Care.
Thank you, Ben. Stacy?
I'm sorry, I tuned in late. What is the question?
Oh, we are just letting Aaron and Gemma, the presenters here, we're letting them know who we are and what our role is on the committee. So it's just introductions.
Oh, hello, my name is Stacy Johnson. I am the owner of a retail shop and cultivation license here in Netherlands named Harvest House.
Maxwell.
Yeah, hi everybody. Maxwell Pollitt. I am the owner of the Flower Collective. We're a products manufacturer and cultivation license in the town of Netherland. My role up to this point has largely been spectator, but I'm here to see what's going on and offer my opinions or expertise wherever they can be used.
Thank you. Wendy.
Hi, good afternoon, everyone. I'm Wendy Morrison, and I am on the team with Aaron and Jenna at the Colorado Public Health, and I provide legal technical assistance.
Thank you very much.
Thanks for having me.
We have another caller that is not Stacy Johnson. Who might that caller be on a phone line?
It's Larry, Netherland PD, Town Marshal.
Hi, Marshall. Brief introduction, please.
Yeah, so Town Marshal, Netherland PD. I missed a couple of these meetings, so my apologies. But, you know, here to help out and learn and move forward.
Thank you very much, everyone. So today is going to be another informational meeting, and I'd like everyone to keep in mind that the next meeting, the meeting following this one, we will be addressing the issue of marijuana hospitality establishments. Specifically, not just the marijuana hospitality establishments as narrowly defined, but I'm going to propose that we consider any establishment that allows consumption on premises. And I am hoping we'll be able to kind of address those as a group. Bear in mind that this committee was established with a twofold charter. The first was, are we going to limit the number of marijuana retail establishments in Netherlands? And if so, how many and what way? And we have accomplished that task already. We're 50% done. Thank you very much, everyone. The next question we were to answer was, will Netherlands allow marijuana hospitality establishments? And if so, do we need to propose additional regulations in further management of those establishments? That is the case that we are going to be discussing very carefully in our next meeting. I will provide an agenda for that meeting as well as suggestions as to directions we may take. So that is my introduction. I'd like everyone to bear in mind what our next meeting is going to be covering while we're listening to this presentation, and be ready with questions. Thank you very much. Erin and Jenna, please proceed.
Wonderful. Thank you so much. Jenna has a presentation that she's going to share. So while she gets that going, I would just say I'm Erin Bertoli, and we are thrilled to be here today. And thank you so much for inviting us to speak. And we hope that we can share some light and answer any questions that you may have. And we'll go forward from there.
Look for everyone.
That way looks good. That's not the note slide. It's the regular slide.
Perfect.
So moving forward, I would just say I'm Erin Bertoli. I'm the project program manager at the Center for Public Health Practice, which is located within the School of Public Health. I manage a kind of small team of folks who work on public health policy at the local level. So we support communities that are looking to implement public health policy. And I would have Jenna introduce yourself.
Yes, so I'm Jenna Metzinger, and I'm a technical assistance provider on Erin's team, and excited to be here to chat with you about marijuana hospitality establishments today.
Great. So I just wanted to do a little bit of level set before we get forward and just kind of make sure that everyone's fully aware of kind of the ways that we can proceed. So as most of you are aware, the Colorado State Legislature passed a bill that made effective January 1, 2020, that would allow for the establishment of local marijuana hospitality establishments. And these are businesses that would allow for the on-site consumption and on-site purchase and consumption of marijuana. And local communities are given kind of three options. The first would be passively do nothing and you are automatically opted out. The way that the language in the bill is written is that in order for these to occur at your local community, you have to take an action. So if you take no action, you are passively opted out. The second option would be to actively opt out. We have seen the city of Silverthorne has done this, and it's more of just kind of taking a step forward and declaring the community values that this is not something that's right for their community, and they don't see these types of establishments in their community. And we're kind of evaluating what that means, because as you can see in the active opt-out, there are two ways to move forward. The city, county, town government, city councils, town councils can vote to allow these with local enhanced provisions, or just allow to go straight forward as it is in the state law, or it can be a vote of the people, either by a referred or initiated measure. So that is happening. We are having discussions with some folks in the town of Breckenridge who are looking at doing that type of thing. So I just wanted to make sure everyone was aware of kind of the ways that this could move forward, and that way that we could support communities in that. So moving forward, when we look at, obviously what we focus on the next slide is the public health or potential public health negative impact of allowing for recreational marijuana. And when we think about what those are, what we've done is we've broken them out into a number of categories. And the first is allowing for the indoor consumption, either smoking or vaping of marijuana, will increase secondhand smoke exposure. It will remove protections. That was a large part of the state bill, is that it rolled back protections that had been in state law for the Colorado Clean Indoor Air Act, which did not allow for the indoor smoking of tobacco or tobacco products. This bill has made an exemption in that. So as a community, you need to decide what that means. And, when we talk about public health, a lot of the reasons that the Colorado Clean Indoor Air Act was passed originally was to provide people a safe workspace so that people were not exposed to a harmful chemical in the process of getting their paycheck, and a more of a workers' rights types issues, and also kind of broadening the collective understanding that bars and restaurants and workplaces such as those are workplaces. And, there are a lot of benefits to working in the hospitality industry. And, that classification of people were not provided the same protections that many other people in different professions were provided. So all of that background is by way of saying that marijuana smoke is a form of indoor air pollution, that the actual smoke itself has many of the same chemicals as tobacco smoke. And something that we're hearing more and more about in the local level is the role of ventilation. And so the ASHRAE, which is, I may get the acronym a little messed up, but it's a National American Society of Heating and Cooling Engineers, I believe. And they have taken a number of positions on the capacity of ventilation to address secondhand tobacco and marijuana smoke. And basically what they have said is that while ventilation may address the cosmetic issues of actually seeing smoke in the air, the harmful components are not removed from the air due to ventilation. And so in public health, we firmly believe that ventilation is not a way to address the public health concerns related to secondhand marijuana smoke exposure. And so just really want to be upfront about that. Number one, it doesn't improve the public health of the air. And number two, it's incredibly expensive. And so allowing businesses and business owners to think that they are doing something that's positive when the science shows that it's not. We just want to, make people aware of what the true benefits of ventilation are, which are not public health related. So the next area that we really talk about is public safety. And this really has to do with the potential increase in impaired driving. So if you click into the next, we can see that there's a substantial amount of evidence that shows that marijuana use by a driver increases the risk of a motor vehicle crash. That's kind of proven in many different journals and studies. And here in Colorado, we see that as well. And we're going to get more into that. The other area is polysubstance or multi-substance use, dual use, that frequently marijuana is not used as a single subject, that it's used in combination with other substances as well. And what does that mean for our roadways? The third kind of pillar that we look at is youth use of marijuana and the potential increase of marijuana availability and advertising and what that does to our youth. So we know that advertising, as with all things, has a strong influence on people's utilization of it. And there's a lot of science that shows that the more advertising and exposure that youth have, it decreases their perception of harm and risk. And we also have a lot of evidence that points to that the number of dispensaries within a community also contributes to reduction in perception of risk and increases utilization and initiation at a younger age. The next area that we look at for public health is local control or lack thereof local control. And so this is something that is really obviously a big concern when we talk to local communities, is that House Bill 1230 allows for a state license, and it creates what we determine as kind of a floor, a minimum standard. And we really encourage communities that are interested in this to take a step further. And what are the additional provisions that are right for Nederland? What are the values and things that you want to have as part of this license? And it also allows for local enforcement. The state does not have additional funds to do enforcement or compliance checks or things like that. And so having a local license would also allow for local enforcement. And then the last area that we really look at public health is around equity. And there's many layers to equity. We know that historically, when you look at tobacco and alcohol retail outlets, due to zoning, due to availability of property, due to cost, we see much higher concentration of alcohol and tobacco outlets in neighborhoods and communities that are historically underserved. And we know that when you live in a neighborhood or a community that has a higher number of establishments like this, including marijuana, that the people who live close to those are at a greater risk to misuse or misuse those substances. So, and then the kind of the other layer of equity, which is not on here, is more focused around ownership. And as this industry continues to grow in Colorado and around the country, who is it that is profiting from it? Are they people who are actually locally in the community, in the neighborhood where these are being sold, or are they outside interests? So looking at the equal opportunity to advance one's career, make money in this industry. So that's just kind of an overview of the areas. And now Jenna is going to go through and kind of spend a little bit more time talking about those. And then hopefully, as we have this conversation, we would love for you to ask questions. And we may not have all the answers, but we'll do our best. And we certainly will circle back with anything that we find that we're unable to answer. So with that, I'll hand it over to Jenna.
Jenna, before we begin with Jenna, is my mic working, Miranda?
Yep.
Oh, okay. Good. So before we move forward, I have a few questions on this page, and I wonder, sure. I'm hoping it would be all right if others who had questions for this page might address that first before we move on to Jenna's part.
Sure.
So secondhand smoke from marijuana has many of the same chemicals as smoke from tobacco. That is an interesting statement, since any burning vegetation will have the same chemicals as smoke from tobacco. What specific chemicals are we concerned about, and what effects do they have? So, for example, I am aware of scientific studies that have indicated that people who begin smoking marijuana very early, that is to say before their brains are fully developed, often will suffer from a shrinked hippocampus as a result, whereas people who smoke after the age of 30 tend to not have a shrunken hippocampus. There are actual physical effects that we see from marijuana, and yet this statement, secondhand smoke is the same as tobacco, is being implied by that statement, but that's not actually what that statement could possibly mean, because it doesn't have all of the dangerous chemicals contained in tobacco smoke. Could you go into some detail, or perhaps Jen is going to go into detail, regarding what that actually means? And is that just intended to be provocative, or is that there are specific chemicals that marijuana and tobacco smoke have that, say, smoke from your wood stove does not have, that are particularly dangerous?
Sure. I'm happy just to...
Can you hear me? Sorry.
Yes.
Okay, sorry.
Jenna, do you want to go into that? I mean, I could answer it very explicitly, and then you can go into, I mean,
good.
There are known carcinogens such as formaldehyde, hydrogen cyanide, lead, mercury, nickel, all of those, as well as some benzenes and cadmium, are present in marijuana smoke as well.
And these are not found in wood smoke.
I do not know about wood smoke. I know that they
because
are.
all of us are exposed to wood smoke all the time because we're in
Correct.
Netherlands.
Yep. I think it has much more to do with the, for tobacco, I know a lot of those are used in the preservation of the product and taking a, a organic plant and making it something that is preserved. I'm not sure exactly their utilization in marijuana. Maybe someone else can, but there are significant studies that found many of the same chemicals that are.
I think we're all aware of the really dangerous stuff that the tobacco industry puts into cigarettes intentionally that aren't actually from the tobacco. They're there to get you addicted better. And so what would be really fascinating would be either, I mean, my concern is with that specific statement. And I think that statement would be more effective if it were able to, if it either identified the specific carcinogens that are specific to marijuana and to tobacco, but not to other smokes to which we're exposed. Because again, we're exposed to other smokes all the time too. And if what we're saying is all smoke is bad, I'm ready to agree with you on that. But that statement would be much more powerful if the specific chemicals were named. And indeed, I don't think you need to bring up tobacco. We all know tobacco is bad, and none of us are advocating switching back to tobacco. But these specific chemicals would be extremely helpful, as well as, for example, how those chemicals influence the developing brain. What you're really driving at is there are problems with marijuana that are glossed over when we talk about marijuana as a medical component. And we're saying that for enjoyment of marijuana as just a recreational thing, if you're going to be smoking marijuana every day, for example, what is it that builds up if you're not ill, not using marijuana as a medical aid, and are smoking marijuana every day? It's those specifics that I think would be much more helpful than kind of this veiled, it's a lot like tobacco. So anyway, that's just a comment.
Thank you so much for that. Yeah. And I think that our goals in this presentation are to go more into that, especially in the coming slides. I have some of these known carcinogens. They're not listed here, but I plan to share them. Ammonia, arsenic, benzene, cadmium, chromium. And I really think the point in bringing that up was not to equate it with tobacco smoke, but just really the goal being that all Coloradans deserve clean air to breathe without having to worry about secondhand smoke exposure.
And that might be a useful context to include in that statement.
And so our goal is really to have Aaron do an overview and then me kind of go into more in depth. And that's my goal with this slide. So
very fine. Before we proceed, is there anyone else on the committee that has a question for Jenna or Aaron?
I'd like to read the metals that are being named as possibly a problem are specific in cannabis. And I mean, if we're going to have a relevant conversation, we should be talking about things that are really present in cannabis. I'm not in any way going to present cannabis as being a benign smoke, but like I pay a lot of money to have my cannabis that I grow here in Netherlands tested for metals, and have being brought into the discussion. It kind of it brings a certain amount of question to the credibility of what's being presented here, because it's just not relevant, and we should be sticking to relevant things.
Thank you so much for that. I appreciate it. And it's really good foundation. I guess I would just give a grounding that the evidence that we present is just that. It's scientific evidence that does not, it can't be applied to one particular business or one particular product. These are science evidence studies that look across the spectrum. And so it may not apply to every single product or vendor in the exact same way. And so that being said, you know, the statements that we make are peer-reviewed scientific journal statements. They're not intended to represent individual products.
Stacy, I'd like to thank you for bringing
It's
up that
not,
question.
it's
And
not
I thought,
individual, it's not individual products. Cannabis in Colorado is tested across the board for metals. So I'll just leave it at that. And they are rejected and not allowed legally to be available for sale if they test above very low thresholds for those metals that you're referencing.
this is Julian. I appreciate your question, and I especially, what comes to mind based on what you're saying is that let us imagine that marijuana, perhaps outside of Colorado, perhaps marijuana provided from people who are not sanctioned by the state, let's imagine that that marijuana does contain these dangerous chemicals. For heaven's sake, it looks to me like that's an important bit of advertising for you and our other cannabis suppliers to include these chemicals are not present in what you're buying here. So I think that's an important thing to bear in mind. Also, Stacey, I'd just like to mention that your voice is cutting out, so you may want to look into your microphone. Are there any other questions before we head forward? Hearing none, Jenna, please proceed.
Okay, thank you. So you will see this bullet point pop up about cancer-causing chemicals. So I think we've had robust discussion on that. And these slides present references at the end, so you can see where all of our statements and peer-reviewed journal article research comes from. So this first piece is what we just discussed. And overall, smoke and vapor-free policies protect workers and the public from exposure to health hazards caused by exposure to secondhand smoke and secondhand vapor. So, and again, our goal here is really to present potential public health considerations that will come up in while your community is thinking about adopting marijuana hospitality establishments. So we're really here to provide information and spur discussion, and you know, we're here for you. So the goal or the concern with not allowing smoke and vapor-free protections to persist indoors would be that those working in marijuana hospitality establishments could be exposed to secondhand smoke for their entire shift, which could be around 8 hours a day. And allowing marijuana smoking or vaping in places where they are now prohibited could undermine laws we have in place that protect the public from exposure to secondhand smoke and secondhand vapor. And as I mentioned before, from the public health perspective, all Coloradans deserve clean air to breathe without having to worry about secondhand smoke or breathing in vape chemicals. And so the exemption in the Colorado Clean Indoor Air Act is of concern. So as Aaron kind of alluded to, we've been hearing rumblings about installing ventilation systems in buildings, even though this is not an effective or proven method to mitigate and protect from secondhand smoke exposure. Ventilation is not a public health solution, nor is it a proven one. And so here, you know, you all have these slides, so you'll have access to this link that states, the CDC states ventilation does not effectively protect non-smokers from secondhand smoke. And so just in terms of ventilation, just making sure that there's not like sunk cost into places having to provide expensive ventilation that won't be effective. You know, the ventilation solution was created in the early 1980s in order to defeat mandatory and voluntary smoking restrictions and to slow the decline of the social acceptability of smoking. So I think that's really why tobacco is being brought into the conversation. I think there's a lot of lessons learned from tobacco that can be applied here, and just make sure that we're not making the same mistakes that we did with tobacco, and making sure we're protecting the public's health as best we can. So again, from a public health perspective, the only way to fully protect people from potential secondhand marijuana smoke or vapor exposure is to maintain clean indoor air protections and not allow smoking and vaping in indoor spaces. And I will preface this with, you know, we are giving this presentation as a way to kind of think about mitigating public health risk. And so there's no way that we couldn't bring this up, as this is one of the main concern, I mean, the biggest concern with marijuana hospitality establishments. And this is only the first part of our presentation. We'll also be presenting ways that communities considering opting into marijuana hospitality establishments can mitigate negative public health impacts. So our goal is to be a resource and kind of provide ways that these can be the most protective for folks if communities want to opt in. So I'll just throw that out there. And then having gone through kind of these two slides in details, I'll offer it up and see if there are any more questions at this point on secondhand smoke exposure and ventilation.
Jenna, this is Julian. I just thought I'd mention that this context is useful. To make the blank statement, people breathing smoke is not as good as not breathing smoke. That's a really good statement that I think we could all agree with. And so this helps quite a bit, and kind of understanding your context, I think, has been helpful to me.
Good.
I had a question, Jenna. This is Allison from BCPH. A lot of times when we've had some conversations about hospitality and the secondhand smoke issues, it's been around sort of a continuum of risk. And so I was wondering if you could talk for a second about the difference between a combustible, like smoking, and vaping, and sort of how that may or may not be risk reduction in terms of protection from secondhand smoke exposure.
Yeah, thank you for asking that. Erin, is it possible for me to lob that one to you?
Sure. I guess I would just say that there is more emerging evidence around second and really third hand vape exposure, and that the most solid evidence really has to do with combustible tobacco. So all of that being said, there are more and more studies coming out to say that the secondhand vape exposure is really similar to secondhand tobacco smoke as far as public health risk. And I think, as marijuana continues to develop and we continue to have more opportunity to study its effects, we'll continue to see that field of science grow as well. I'm happy to follow up with you about some more detailed kind of differentiation between vape exposure risk and tobacco risk, and what the overlying parts are and where the crosswalk is. But I guess kind of the upshot is that there's not a huge difference as far as health impacts.
As a newbie to WebEx, I just realized you can raise your hand. Ben, you've raised your hand. Do you have a question?
Trustee Taylor, you have me rethinking my wood stove. In fact, I know that it can be more harmful than cigarettes. Of course, nobody's smoking their firewood, and I think that's kind of a key difference here. Though I do wonder, and maybe this is more a question, with the ventilation not being a solution, perhaps, I mean, are there municipalities that have decided to do outdoor smoking, I guess, and even with the indoor option, and even with ventilation, would not pedestrians and neighboring businesses that might share a wall still be smelling the odor? Whether that's a health concern directly for a secondhand smoke or not, right? It may not be something that you'd want on your streets or in your a neighboring business.
Yeah, that's a good point, Ben. I think to your point, there could definitely be, an outdoor smoking area potentially, but then you come into concerns of, okay, well, where is a hospitality establishment located? Is it, are there homes right behind it? It becomes more difficult to control secondhand smoke exposure and odor when you have an outdoor use area versus indoor. Obviously, outdoor use, I think, would control for secondhand smoke a little bit better than indoor, but it comes with a whole other set of issues that include zoning issues. And like you said, potentially it could drift over into somebody else's residence or a business. So, but it's an option to consider. Is there anything you'd want to add to that, Erin?
Just that this is where Jenna and I are glad that we just present the evidence and not have to make the decisions.
Right.
Right. It's tough, and figuring out how to kind of address these public health risks is tricky, but definitely important to kind of work through and make sure that you're serving your community.
And I know maybe it was sort of off topic then. Is a public health issue.
Sorry, Ben, it's hard to hear you.
Sorry, that's got to get in your earbuds. So maybe I was just a little off of the public health subject there, because because the odor itself is not what's harmful, so maybe that's not an area that you've delved into as much. But I guess I was just wondering if, I know that the ventilation may not be a panacea from a public health perspective for the smoke itself. I guess I was just wondering if it did anything with, if you happen to know whether it addressed the odor issue alone, whether next door, sharing a wall, or, I mean, there's houses in town, I can walk a block away or down the block rather, and I can smell it from outside. Like, let's say that's like sharing a wall. So I understand the odor is not a public health matter in and of itself, other than maybe a perception and availability, but do you know whether those ventilation systems prevent the odor from being outside of the business or escaping into a neighboring business to a shared wall?
I would like to interject something very quickly here. I suspect, Ben, that if you can smell the odor, you're inhaling the chemicals.
And I don't know. I mean, that's a good question. That's a good question.
Yeah.
I should have asked, assuming. I don't know.
Oh, and I didn't mean to answer the question. I was just injecting that.
No, I thank you. I guess, so maybe, I think your point is maybe it is also a public health issue, and it's not just a concern about whether you're smelling it or not.
So I should ask, is there that I've suggested a connection, Erin and Jenna, and I leave it to you to correct me or to carry that forward.
Well, primarily, again, looking at tobacco is kind of the field that we can draw most from. The public health evidence for negative health consequences falls off around about 20 to 25 feet distance from the smoker. Again, a lot of that has to take into wind considerations and things like that. So it gets a little bit more tricky of negative health consequences outdoors beyond 20, 25 feet. I would just add that in addition to the actual health consequences, I think kind of what Ben is alluding to are odor and not so much health consequences, but use risk normalization. It presents a whole nother set of issues outside of direct health consequences, which we consider in public health as well.
And I'd also think it's important, like you brought up, Ben, to think about businesses that might be sharing a wall with marijuana hospitality establishments. It's very possible that secondhand smoke can kind of creep through vents, or that the odor could seep into another business if they were sharing a wall. So it could be a consideration that the town thinks about hospitality establishments being standalone buildings so that they wouldn't negatively influence other businesses in that kind of a way. So I think your point is definitely valid. I think that if a business was sharing a wall with another business, there could be that risk. Other thoughts or comments? Okay, I'll keep us moving so we can kind of get through this, because we'll have general questions at the end as well, once you've kind of had the opportunity to think about all of this. So again, I mean, I think the secondhand smoke risk piece is really something that you all need to think about before you've decided whether you're going to opt in or not. You know, I think that can really make or break the discussion. Like, do we want to invite indoor smoking into our community? But, you know, if opting in is something that the community has decided is right for them, there's definitely ways that we'd like to recommend to mitigate public health risk. So the first one that we'd like to bring up and just kind of insert into the discussion is preventing impaired driving. So I think we can all agree the economic and human costs of the consequences of impaired driving are immense. And so if a community is considering allowing increased access to marijuana, impaired driving risks can't be left out of the discussion. So as was mentioned before, there's substantial evidence that recent marijuana use by a driver increases their risk of motor vehicle crash. And the citation is here. Increased crash risk could be up to 7 times greater for those who use marijuana compared to those who did not. And then in Colorado in 2017, in DUI cases that tested for multiple substances, 51% tested positive for both alcohol and THC. So we wanted to bring polysubstance use into the conversation. It's an issue that can't be ignored when considering marijuana hospitality rooms, given that someone could potentially take an edible in a marijuana hospitality establishment, you know, walk across the street or down the street to a bar, drink a beer, feel fine, and get behind the wheel, maybe not anticipating that the effects of the edible would hit them while they're driving, and now they're extremely impaired. So, you know, unfortunately, there's no way to prevent combined substance use like this, as we can't control where people go and purchase products that they can consume legally. But I think it's really something to kind of ponder and think about and pick apart if you want to allow hospitality establishments, that's something that could happen. And then overall, successful impaired driving prevention programs have included a multifaceted approach that includes public education, media advocacy, really designed to gain the support of policymakers and the general public. So a few pieces that you could consider given that research could be providing and promoting rideshare programs, creating parking provisions to allow free options for business patrons, pieces like this. So just kind of thinking about how these stats translate to policy, a marijuana hospitality establishment ordinance could include pieces that require the new businesses to put systems in place that can help prevent impaired driving, because I'm sure that's important to them as well. There's also opportunity to kind of discuss how your community can prevent impaired driving as an ongoing public safety conversation. So, you know, I think that these options are definitely ones that could be useful. You know, a ride sharing program doesn't just have to be pay per service like Lyft or Uber, but could be things like a tipsy taxi that's funded by the town or city that could be supplemented by other funding. And, you know, education should focus on planning ahead and taking a ride share to get there and back. And I think allowing for free parking provisions can help folks feel comfortable leaving their car overnight and potentially using a rideshare program instead of stressing about getting towed or getting a parking ticket. So these are kind of structural things that can be in place that could potentially lower and prevent impaired driving. And we recommend also including requiring local data collection and then reporting requirements, maybe to the town, like to the trustees, on marijuana impaired driving locally, just to monitor the issue, make sure rates haven't gone up. If they have, kind of figuring out what you can do from there. You could collect data on injuries or fatalities related to marijuana involved collisions, just making sure that the community works together to decrease this. And then the next 2 bullet points are at the bottom of the list on purpose. I think the focus here should really be on preventing impaired driving on a large scale before law enforcement needs to get involved. But you could also require local businesses to kind of notify law enforcement when a patron is clearly too impaired to drive or operate a motor vehicle, and then require, you know, local DUI or DWUI enforcement efforts. So, you know, to this point, a community can enforce impaired driving and say they're addressing the issue, but the goal is really to have the default action be that someone never gets behind the wheel. So like making the safe choice the easy choice. And I think it's also important due to the disproportionate impact that DUIs and DWUI enforcement can have on folks and getting them involved in the judicial system. So that was kind of a lot. I feel like I just word vomited. So at this point, are there any questions about preventing impaired driving?
It's Miranda. I just want to let maybe some of the callers know that if you want to make a comment, you may need to press *6 now to do so.
Hey, this is Larry at Ned PD. I'll just chime in here real quick. Reference potentially requiring additional DUI enforcements surrounding shops. You know, that if that's the case, that the town would want to do that, or something to that effect. You know, somewhere that money's got to come somewhere to hire that additional officer if that's specifically targeting DWAI enforcements. I'll say that. And then in regards just overall to businesses, I think we would see less locals using the businesses and more visitors from town and out-of-state people from town. So a lot of people in town already walk back and forth to the bars and stuff like that, and they're pretty cognizant. But the times where we do see people that are overly intoxicated by marijuana, whether it's inhalation or edibles, they're always out-of-staters. So, and it hits them harder than they expect. So that's where we're going to see the problems come from. We're not going to see in my opinion, we're not going to see the problems come from internally in town. It's going to be our tourism that's going to add to that problem or potential problem.
Thank you, Marshall Johnson. I'd like to add that we all know that over the weekends, especially in the summer, the place is full of people from Nevada, Arkansas, Kansas, who haven't sampled marijuana before and are going to try it now because they're in Netherlands. That can be a very difficult problem. And I know that our retail establishments hire people and train them to be aware of people who are naive in this area, but even that's not enough. Marshall Johns probably still sees plenty of people who escaped that filter. So I know we have several more slides to go, and I would like to hold as close as I could to a 1-hour presentation. And I know I'm the one who got this started, and I'm apologizing for that right now. I wonder if we could allow Aaron and Jenna to complete the presentation and save the rest of our questions for the end of the presentation, just so we can get as close as possible to adjourning on the hour. So if you will oblige me in that area, committee, Jenna, please proceed.
Absolutely. And on these slides, again, you all have access to these slides. We've put kind of examples of partners to engage. So obviously, you know, local law enforcement and marijuana business owners are high on the list. And also think about, you know, any local transportation agencies. I'm not sure what that looks like in Netherlands. If you consider like adding something like a taxi or something like that, kind of as a part of the hospitality establishment language. You know, fees, licensing fees could help fund something like that, as long as everyone agrees that that's an important part of the policy. So then with youth marijuana prevention, I don't think anything here, especially based on what Trustee Taylor said earlier, will come as a surprise. But youth marijuana use can be detrimental to a young person's development, both socially and physically, including brain development. And prevention efforts to mitigate the use of marijuana among young people should be a priority in our communities. And I believe we can't have conversations about marijuana hospitality establishments without kind of bringing this up. So here are a few statistics of note from the 2019 Healthy Kids Colorado survey. So for Colorado high school students and recent changes in methods of marijuana consumption, so in 2019, the overall current or past 30-day marijuana use prevalence among high school students in Colorado was 20.6%. Colorado youth's perception of risk for using marijuana have been consistently lower than the national average. And then comparing methods of use by youth in 2017 and 2019, the Healthy Kids Colorado survey shows that the prevalence of dabbing and vaporizing as methods of marijuana use are increasing among our young people. So it's something definitely to keep our eyes on. In 2019, 10.2% of Colorado high school students dabbed at least once, compared to 6.9% in 2017. So that's actually a pretty big increase. These are concerning trends since marijuana products associated with these types of methods of use often contain high concentrations of THC, which we all know is the primary psychoactive compound within marijuana. And so communities should prioritize these marijuana prevention efforts, especially when considering these marijuana hospitality businesses. Oh yes, sorry, there was one more. So dabbing became the second most usually used method next to smoking among high school students, which is pretty crazy. So these are kind of talking about normalization of use. Research shows that marijuana advertising influences the perception of young people, normalizing use and decreasing perceptions of harm, like we talked about previously. The number of marijuana dispensaries within a community can be directly correlated with increased youth marijuana use. So studies suggest that efforts to limit the number of marijuana outlets in a community may help to curb youth marijuana use. And it sounds like that conversation has already started with this group, so that's great. As suggested by literature on tobacco and alcohol, marijuana businesses located close to schools may increase the risk of marijuana use among adolescents. So with that, obviously with youth marijuana prevention, I think the most important partner to engage would be young people in your community and making sure that they have an opportunity for their voice to be heard. So our recommendations around youth prevention include limiting youth access to and exposure to marijuana in their community through these ways. So through local licensing and enforcement, you can restrict the time, place, and manner of hospitality establishment sales. And that could include restriction on marijuana advertising in a community to decrease normalization and make sure it doesn't look, flashy and sexy to a young person. Limit the number of marijuana businesses in a community. Zoning or proximity restrictions near places where youth frequent. And just like we mentioned before, include data collection and reporting requirements. And that's really just to monitor whether youth use or normalization is going up or down and being able to respond to that accordingly. And then of course, retailer and community education so that everyone is united by a common goal, which I think we already are, which is preventing youth substance use. So, another question I wanted to pose was making sure that we value young people's expertise and contribution with this. So questions to kind of ask ourselves are, have youth who may be disproportionately harmed by allowing for marijuana hospitality establishments had an opportunity to weigh in on this issue? And what are the different ways that young people's contributions can be recognized and their participation celebrated? So I would encourage you all to reach out to the young people in Nederland and make sure that they're able to kind of speak their piece on this and what they see in their schools.
Jenna, this is Julian. I just thought I'd mention that that's one of the reasons Ben Goldsmith is here. He's part of our youth outreach program here in Nederland.
Awesome.
I suspect he is going to be able to help us all a lot.
Awesome. Thanks so much, Ben.
Well, I will absolutely be able to put you in touch with youth themselves when you want to talk to them.
And then this piece on hospitality licensing is all about local control. We've touched about this a little bit on the previous piece on youth marijuana prevention, but here is why local marijuana hospitality licensing helps mitigate the public health risk of allowing for them. So Aaron mentioned earlier, the state law sets a minimum state standard, but local jurisdictions can and should require an additional local license. Creating a locally controlled licensing system is a proven method to address youth access, and it represents a critical component to any local marijuana hospitality policy. It's a proven approach to increasing and enforcing restrictions on illegal sales and other known youth-targeted promotional, product placement, and pricing tactics, and that's specific to tobacco, not marijuana. And local licensing can also strengthen relationships with marijuana businesses. You know, we've really found that business owners are open and willing to use state and local education materials, engage in community protection efforts, and partner with local advocates. So I think the biggest part of this is fees can be used to fund enforcement so that it's not an additional strain on PD, as was kind of mentioned earlier, making sure that whatever licensing system you put in place, the fees are kind of self-funding, because any policy that's enacted but not enforced, you know, there's no way to know if it's truly working. So here are some evidence-based policy provisions, and again, a lot of them were mentioned on the youth slide. So local retail licensing programs that include fees high enough to pay for enforcement. Enforcement programs must include revocation and suspension of licenses. Enforcement would include monitoring compliance with multiple aspects of the law, so code enforcement or training of employees, and that's really just to make sure the penalties are meaningful. I don't anticipate necessarily that Nederland would have to revoke or suspend many licenses, but just so they know, you know, if you sell to a young person, that the penalties are high. And then through local licensing and enforcement, restrict the time, place, and manner of the hospitality establishment sales. So that includes the density and zoning requirements that help protect youth and the restriction on advertising in a community. And just to hammer it home, we also recommend including data collection and reporting requirements. So, you know, reports out to the trustees annually or twice a year on how enforcement is going and how the businesses are operating in the community. So that was a lot, but here's our kind of summary slide about hospitality establishments. So this is a list of the potential negative public health impacts that you all will need to talk through and make sure you kind of come to a consensus. So we talked early on about the secondhand marijuana smoke or vape exposure for patrons and employees. And then I think Ben brought up a great point of also potentially neighboring businesses or neighborhoods. And then public safety, impaired driving concerns. There should probably be something baked into your policy about how impaired driving will be prevented. Youth marijuana prevention, which is influenced by advertising, density, and proximity to youth serving establishments. So having youth protections in it would be vital. And then, of course, local marijuana hospitality establishment licensing for local control. And then as a way to kind of enforce, you know, advertising restrictions, density caps, and proximity. So that was a lot on hospitality establishments, and I know that Ms. Fisher also asked us to talk about delivery, and so I will quickly pass it over to Erin to kind of talk about some high-level issues of concern from a public health perspective with delivery, and then we can ask some questions.
Great, thanks so much, Jenna. I guess I would just say that before we delve too far into this, on January 1 of 2021, it became legal for local communities to opt into local delivery of retail marijuana. Medical has been allowed for a year, and now it is allowing for retail. And I guess the main difference between this and the hospitality is that the state bill that sets the minimum standards is pretty comprehensive and really covers a lot of the areas that presented the greatest concern, number one. And number two is there's not a ton of evidence on this. As we all know, just here in Colorado, since pandemic, alcohol has just started to be allowed to deliver. So there's just kind of a lot to learn about this. So we don't really have as many strong evidence-based recommendations related to marijuana delivery as we do to other ones. So really, these are just kind of questions that we would encourage you and your community dialogue and your community partners to think about and have during this process. And the first one is delivery between jurisdictions, and whether or not Nederland opts into it. Would that also include allowing for deliveries from other jurisdictions to deliver into Nederland? And what would that look like? The city of Aurora has opted in. They are the first. They did it at the end of December, and they are stating that they can deliver to other municipalities that allow for it, and they allow other municipalities to deliver into Aurora. So that's a choice that they've made, and Netherland could see if that was the right choice for you. The second kind of area would be preventing youth diversion sales via delivery. I mean, this is kind of the main youth concern, is that there's really strict and very well followed enforcement in store sales, and we would just like to see those kind of level of precaution attempted to be mirrored at delivery as well, just to make sure that we minimize use. And then looping, this is a concern that exists in retail sales as well, and it implies that there are limits set, but there's not like a system that somehow collects all the product that's been purchased. And so just acknowledging that potentially if you have multiple businesses that deliver, an individual could theoretically purchase from multiple businesses in one day, thereby going around the established limits. Another real big area for public health related to delivery really is around the safety of drivers. And there are some pretty decent precautions in the state law, but I think that that would be a real concern. They have a significant amount of product on them. They have a significant amount of cash. So making sure that those people are really safe while doing their job would be an important consideration. Another area would be utilizing an app, i.e. Grubhub, Uber Eats type idea, Drizzly, versus an independent business that's already established. So kind of having that conversation of, there's a lot of percolations of what this would look like, and try to figure out what would meet the community values of Netherlands. And then obviously more marijuana businesses increases access and availability, whether that business is delivery or hospitality or retail sales or medical sales and all of that. So we just know that the higher the number of businesses, increases normalization for youth. And then we've heard some concerns around age verification. Like there's a lot of scanners that are used. We have 2 people looking at IDs in retail stores. We're on a call not too long ago where there was concern that those scanners, you can purchase fake IDs that go around the scanners, and they're rather expensive. So is that a business cost for those who wanted to deliver, or is that something the city would provide, and setting rules for what the scanners are? So anyway, that's just another area that would need to be flushed out in this conversation. And that's what I have on delivery.
Erin and Jenna, thank you very much. I have a quick question. The evidence seems very clear that anyone who is inebriated and is driving a car is more likely to be in an accident. And so that, I think, goes without saying. I've found a couple of studies, and our biggest problem is that marijuana as a Schedule I drug makes it extremely difficult to engage in scholarly research. And so there is a paucity of research generally. But some of the studies that I've been able to find, often from Sweden or Norway, indicate that while marijuana users are involved in accidents about as much as alcohol users, those accidents tend to be less often fatal. Do you have any statistics on that, Erin or Jenna, that might further flesh out that understanding of what we're looking at for inebriated driving under marijuana versus under alcohol?
I personally don't. I think that Jenna in the slides has some really good studies that the Colorado Department of Transportation has recently issued, and they might have a greater understanding of the fatality of accidents.
Yeah. I wasn't thinking about that, of course, and you've provided us with the links, and I look forward to looking those
Here,
over.
Jenna just put it up on the
Yeah, very
slide.
fine.
I think it's number
I will
11.
find it.
11.
Very
Yep.
fine.
Yep.
Are there any other questions for Jenna or Erin? Ben.
I can be really quick this time. One thing that wasn't mentioned were the idea of party buses, mobile lounges. Are there any specific are there any specific concerns related to those? How do those being mobile interact? Might they the considerations be when you're talking about time, place, that zoning, all those things that may apply to some place that's stationary rather than a party bus? Are there any implications around that? Yeah, those are my questions.
It's a good question.
And finally, could those, if you accept hospitality and let's say just don't want, let's say your answer is we can't really control for that well, are there places that would, is it possible to for some place to accept some form of hospitality business without accepting that specific type of business, a bus rolling through town?
Jenna, do you want me to go or you want to go?
If you start, I have some thoughts, but they're kind of
Okay.
opinions.
Yeah, I think the evidence around it. So one, mobile hospitality is permitted under 1230. There are some rules related to it, such as like filing the route and not being able to stop in a place for longer than 30 minutes. So there are some rules around that. To your second point is if Netherlands were, to say that the mobile hospitality wasn't something that fit your community values, I'd have to double, triple check, but it is my understanding that yes, you could say that that particular slice of license, you wouldn't issue those licenses in Netherlands, or you would prohibit those types of business. I think that would be legit.
Mm-hmm. Yeah, and you want whatever you end up passing to support your community values. And I think the biggest thing that I can see, especially based on what we just presented, would be normalization. I mean, again, if young people are seeing buses driving all around town where folks are using marijuana in them, that would be of concern. They would see that as a completely normal thing. So I think that's kind of how it needs to be framed and seen. And then I think we've heard other concerns about the driver of the bus and being exposed to the secondhand marijuana smoke while they're driving. Again, I don't know that we necessarily have an answer for that, but there's things that need to be considered if you were going to allow for mobile. It seems like there are a lot of logistics with it that would make it really tough. So I'm not sure if it's something that a community would want to do, but yeah, it's a good point to bring up.
Any other questions?
This is Allison. One thing that I've been thinking about is around a lot of the safety issues, doing the ID checks and things like that, that there would be an increased cost to ensure compliance with that and an increased cost of enforcement. And the town marshal was talking about that earlier with DUIs, but I was thinking about that with both delivery and hospitality. And just wondering if you have seen anything or have any thoughts on how a town would make sure that all those safety precautions are followed. I think one thing that I hear a lot from folks is that they are just concerned about the intent of some of the safety stuff with actually being able to do it. Like, is there capacity to implement compliance checks and things like that?
Yeah, and that's a good point to bring up. And I think that's why we really recommend having a local license program, because then whatever licensing fee someone has to pay to get a local marijuana hospitality establishment license could go right back into funding enforcement and making sure that compliance checks happen, and that there's no advertising that's breaking the restrictions that potentially your town has put up, or pieces like that. So I think that would be the importance of the local control, is making sure that not only are you creating a structure where you can tailor the marijuana hospitality establishment ordinance to be exactly what fits your community, but also make it so that the fees just go right back into the program and fund enforcement, and maybe even potentially prevention efforts for youth as well. pieces like that. So, and I don't think that it would have to be a crazy high number for that to be able to be met. So I think that answers your question, but Erin, is there anything you would want to add to that?
No, I think that's great.
And that answers my question. Thanks.
And last call for questions.
And just a reminder, if you're on the phone, *6 if you have a question.
All right. We've kept it pretty close to 1 hour. Thank you very much. Jenna and Erin, thank you so much for making this presentation. I think we'll all appreciate it very much. And is there any last comment anyone wants to make before we adjourn? Remember that our next meeting is going to be discussing this exact topic, marijuana hospitality establishments, whether we're going to allow them, and if so, what additional rules we may request. Any other comments before we adjourn? Then I'll leave that to say, Jenna and Erin, thank you very much for giving this presentation. And I'll see everyone at our next meeting, except, of course, for you, Erin and Jenna. Meeting adjourned. Thank you, everyone.
Thank you.
Thank you.
So, Miranda?
Yes, hello.